As a mom and a parent, you know that fighting for your kids and advocating for your kids is the most important thing, important role that you have, especially when it comes to health crises. Good morning. My name is Megan Clanahan. I am the co-owner of Houston Moms, and today I have the pleasure of bringing to you a fantastic story, but also a really important story as it relates to advocating for your child and their healthcare journey. And with us today is Mom Jessica Lewis, and we have her nurse practitioner, Ashley Moses, with UTMB Health. Thank you so much for joining, ladies.
Thank you.
You.
So let's just jump right in. Jessica, can you tell us a little bit about you and Olin and why you're here?
Yes, sure. Jessica Lewis. I am a mother of two amazing boys, currently a 5 and a 7-year-old. And Olin, when he was 3, so not very long ago, he started having some puffiness and some things like that going on his face. And my older son being allergy prone and having all these things, I did, what I thought was the right thing. I thought he had a bee sting or he had something that was creating this, swelling in his face. So we took him to the allergy doctor after we had done the, Benadryl and that type of stuff. And the doctor that was there knew that it was not related to that and it was related to his kidneys. So he immediately said, hey, rather than sending you to another specialist, let me just run the blood work. Let me just do the panels and see what we need to do. And his suspicion was correct that it was something to do with his kidneys. And that something was called nephrotic syndrome, something that I had never, ever heard of. And it was truly just a kid with puffy face. Like it truly did look like maybe he was bit by something he was allergic to. So the last thing that I thought was that it was something to that level. And within 24 hours, we were being admitted to a hospital. We live in Katy. So we were admitted to a hospital that was closer to us because it's what we knew. So we went there and we were there for probably about a week. And the issue is that his body had all this fluid due to the filtering of his kidney. We didn't really know what the issue was, right? At this point, that's a pretty, Ashley could speak better to this than I can, but it was a pretty general diagnosis. But you knew the things to treat it, to get the swelling down, to get the fluid out. And so that's what we did for, the week. And then this was here's your diagnosis and we'll see you you're released now and we'll see you in a couple of months. And, that's when reality kind of sits in and we're like, well, what does this mean for us? We just went from thinking we had allergies and then all of a sudden we're dealing with this and we didn't really know what to do next.
So is that when did Ashley, we're gonna bring you into the conversation. So you are a nurse practitioner with UTMB Health. When did you enter this story?
So I actually met Jessica and Olin when I was working in a urgent care actually in Katy. So he came into the office. He was starting to spill a little bit of protein out in his urine. So he was having what we would call a relapse where they're not really responding to steroids anymore. And she's like, well, he has nephrotic syndrome. Do you know what nephrotic syndrome is? And I'm like, yeah, I'm familiar with it. I work at UTMB nephrology, so I'm pretty familiar with the diagnosis. So she told me all about it. And then, of course, I did increase his steroids. And then I said, hey, we'll increase these. We'll wean him slowly, get him back to baseline, and then just follow up with his nephrologist. So then they followed back up with me. I look at my schedule, and then I saw him on my schedule at UTMB. And so that's kind of how we made that connection there. And then he started to see I and Dr. Balachandra at UTMB Hospital here in Webster.
What a cool, I mean, because Webster isn't nearby. And so
It's not. What brought me to her, the reason why we went there is the care that we were currently under. We were released from the hospital. Then so there's at-home testing every single day that goes along with this. And so as soon as I would see a little bit of a rise, I would call and tell them, hey, this is happening. Like, oh, it's okay. You're fine. Just keep doing it. Keep going along. And I had noticed that the at-home testing always seemed slightly lower levels than when we went in, you know, maybe more medical grade testing that they do versus my Amazon sticks that I use. So I truly went to urgent care and said, I know this is a random request. He's not sick, but I just want to get a urine test. And that's when Ashley was like, that's not an everyday request that you have. And so it was a little bit of the fact that the person on staff that day was in nephrology was, I mean, to this day, I'm like, that is like a divine intervention thing in my mind. So I'm so grateful. And then from that moment, I told Ashley, she was like, here's my cell phone. And she even said, she was like, he needs to be on way higher dosage than he should be on. And like I said, what's the chance of having a pediatric nephrologist working urgent care? It was a Saturday or Sunday. I don't know. It was a random.
It was a weekend.
And it was just, it was one of those mom gut feelings where I was like, no, I don't. And it was one of those, okay, we'll see you in a couple of months, or we'll see you this. So it was one of those feelings that I was like, I know I don't want to, play the Dr. Google game or any of this, but I had read enough and I don't know, just something wasn't right. And even though you're in, this amazing facility that everybody wants to take their kids to and blah, 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 I just didn't feel right. And then I'm telling you, I met Ashley, I'm like, you're never getting rid of me.
Yeah, surprised.
Yes.
Well, you guys are stuck together now.
We are. We absolutely are. But she gave me her cell phone from that moment. We scheduled an appointment. I think I saw you 2 or 3 days later. We were already kind of putting feelers out for second opinions on how this should be treated. And so we went from, our current treatment plan was we'll see you every 3 months and then 6 months. So within that year's time, we would have visited with our doctor maybe twice after our hospitalization. So we met with Ashley and then Dr. B, and his schedule was, no, I want to see you once a month until we get this, until we get a plan. But I'm telling you, it was all that, it still blows my mind every time I tell the story.
I love it. And what a testament to just the love and care that somebody would have for a child and then you're hearing the different stories. So Ashley, can you fill us in a little bit about how Olin is doing now and just what sort of drew you to make this connection to where now their family is seeing you?
So when Olin first came to us, of course, he was diagnosed with the general condition of nephrotic syndrome. But we're like, maybe there's something bigger going on. Maybe there's something a little bit deeper going on. So we did order for a kidney biopsy. And then we actually found out that he had something called FSGS. So it's where parts of the glomerulus of the kidney are a little bit scarred. So sometimes you can have nephrotic syndrome secondary to that. So we did have to change his medications quite a bit. We put him on something a little bit stronger than steroids, but it was a smaller dose of immunosuppressants because steroids are also immunosuppressants. Now we've kind of gotten the steroids almost to like minimal. I think we actually might have, discontinued them or made them really, really low.
Just very small amount. Yeah.
Yeah. So really, really low. And now we just have him on a small dose of immunosuppressant. So he's doing really, really well overall. And, I just love seeing them when they come in the office. They're just a really, really loving family. And then Olin is always so happy. And then he's just doing really good. He's growing up on me. The older he gets, I'm just like, oh my gosh, you leave 18 soon. Oh my gosh.
I know. No, it truly has been an incredible journey. And, like she said, the biopsy and diagnosis that we received, if we would have been on the same original treatment plan of, 3 and then 6 months, there's no way we probably still wouldn't have had that biopsy. We'd still be treating the general, diagnosis versus the very direct one. So once again, it doesn't matter that we drive, over an hour, a month, but it's worth it, right? Because we were able to get, I know we would not have been diagnosed probably until maybe now, and who knows. And, since then we've, thankfully, and we've only had one relapse. And when that did happen, again, we're in, 10 o'clock on a Monday night and Ashley's on the phone with me and Dr. B's on the phone with me. And, they never take time off. They're on our speed dial, and if something just looks funny on his face, I'll text her a picture like, are we good? Are we good? Like,
No.
so it's been, like I said, we're stuck with each other, but it's been an incredible journey. That's
So I think what I'm hearing from you, and kind of also the purpose of this video, is not just obviously the incredible care at UTMB held, but how to advocate for your child. Like, you know your child better than anyone.
yes.
And I have a baby. Well, she's not a baby anymore. She's almost 14. But she has a congenital heart defect. And so um she had had surgery and went into heart failure. And I was like fighting with these doctors, being like, hey, like, she's not okay. She's
Right.
not right. And we need to fix something. And she ended up needing an emergency open heart surgery. Um, but yeah, and I'm not tooting my own mom horn, but kind of like tweet, tweet, like toot, toot.
Yes.
Like, I'm like, I know my kid. So can you kind of speak to the advocacy and how you, because it is a balance too, because we need our care team to work with us.
Right.
But we also need to say, like, hey, like, I have this feeling.
Yes. Well, I think we just get so caught up in, you go to the pediatrician and then you find the nearest caregiver and you say, okay, this is where I'm supposed to be because the pediatrician said it's okay. And then it's the closest place. We were sent to this hospital and here's their specialist. So let's just roll with it. Right. And I think that that's such a common thing. It's a convenience thing. You just trust what has worked for others. Um, and I think it just came to the point of just when you're not, I don't know, I kind of felt like they were questioning, well, are you testing him right? And in my mind, I'm like, he is my baby. Yes, I'm
Yeah.
testing him, yes, I'm going to do everything in my power. So I think once you're not comfortable or anytime you have any question, don't second guess it. It
Mhm.
doesn't hurt to go ask somebody else or get a second opinion and if you have to drive an hour and a half across Houston to do it, it's your baby. I mean, you're
That-
gonna do it, right?
that's-
So I really do think that mama gut is a real thing
Yes.
and you have to act on it. You have to trust it. And just because it's who your family's used or just because it's, who you were referred to, that doesn't have to be the Bible. Um,
And Ashley, in that vein, so like you have, obviously parents who are coming to you on a daily basis, and like, what do you tell these moms and parents that are being like, hey, like, this is what I'm seeing. What's the best way that parents can communicate with you, so that their child can have the best outcome?
So, number one is just accessibility. Like, I try to always just make myself accessible, whether it's a Saturday, Sunday. I'm like, you can call me, text me, my chart me, like whatever the case may be, because you know your child a lot better than I do. I may spend every bit of 30 minutes to an hour, right, in office visits, but you see these children or your kids every single day. So I have to work with you. A lot of times we forget, we just go through the motions because we're supposed to see X amount of patients per day, that we are still dealing with human lives. So we have to be sure that we're working with the parents and then not just saying, okay, this is it. There's nothing else going on and not listening to those concerns that parents have. So I try to just make sure that that's something that I continue to do. I've always done. And, sometimes as providers, we can always learn, even from the family members, you can learn from them.
That's such a humbling statement too, because I think it is really important to know that, like, you know a lot about the medical field that we don't know. But then we have like this other intrinsic knowledge out here, and to kind of be like, you know what? I believe you. And I
Yeah.
think that's the most important thing that you can say to a parent is, I believe you. Like, I believe that this is happening. And we're gonna get to the bottom of it. What I love about UTMB Health is the care teams that y'all assemble to provide like a really um, a big picture for children like Olin.
Yeah.
And so he'll be followed, I'm sure, by yourself and Dr. B. I know it's a big name. How do we say that?
Dr. Balachandra.
I wasn't even gonna try. I read the article.
Yes.
And I was like, I looked at it and I was like, no, 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 we're not doing that. But what I am gonna do is I'm gonna post this article below, and it's a great snapshot of Olin's journey and Jessica's fight to get care for her child, and Ashley sweeping in on what seemed to be just a really I don't know, a blessed day, honestly, where she happened to be there at an urgent care on a weekend. So I think it's a wonderful reminder that we never stop fighting for our kids, and let's not ignore things. And caregivers, if they're the ones you should be with, will be open to receive that. I think as the point here. And so Jessica, Ashley, I know you guys have busy lives. I need to get back to them, but I appreciate you so much today for joining us. Thank you.
Thank you.
So we're going to drop some comments below, including that article in the story, as well as how to find a provider at UTMB Health. They are preferred providers for the Houston Moms and Southeast area. And then obviously, as we see here, and we have people who drive from Katy all the way down to Webster, and because there's nothing we won't do for our children. So we're thankful for your support. We will be back again next month with another important health video, bringing you awareness from our friends and partners at UTMB Health. Until then, have a great day.